In our day-to-day livelihood, we normally relate the terms disease and illness in place of each other when we are talking about health. Before we move on the next topic, firstly, we should know the basic difference between disease and illness. Disease is a state of experience by the body when one or more of the control systems of the body are not functioning normally. While on the other hand, illness refers to a distress feeling of a person when one is sick or suffering from some disease. It is not appropriate to conclude that anyone being merely free from illness or disease is healthy. Now we are going to learn something about types of disease. So there are two types of disease. Communicable disease. These disease requires agents to move or transmit from person to person or from environment to person. There are various agents that can spread communicable disease. First one is bacterial. These agents are responsible for typhoid, cholera, tuberculosis. Second, viral. These agents are responsible for common cold, influenza, HIV infection, dengue. Third, fungal. These agents are responsible for fungal infections of nails, groins, skin, hair. Fourth, parasitic. These agents are responsible for infestations of intestinal worms like roundworm or lice. Modes of transmission. The modes of transmission can be classified as direct and indirect transmission. Firstly, we will discuss on direct transmission. It includes as follows. Direct contact or touching. When we touch a person or come in direct contact with the skin of the diseased person, it transmits infections like skin and eye infection. Droplet infection. Spray of droplets of saliva or secretion of a diseased person spreads common cold, tuberculosis. Contact with soil can cause acquiring the disease agent directly and may spread diseases like hookworm infestation. Inoculation into skin or mucosa. Certain diseases spreads in another way. For example, rabies is spread to humans from animals. It is generally known that it occurs due to a dog bite or a monkey bite. The HIV, human immunodeficiency virus, can be transmitted by sexual contact or through transmission of infected blood from an infected person. Second one is indirect transmission. It includes as follows. Communicable diseases are also transmitted indirectly in the following ways that are popularly known as 5 Fs. It includes the first F states flies. They are responsible for spreading disease from environment to person. The second F fingers, responsible for spreading disease from one person to another. The third F food, responsible to spread disease from environment to person or from person to person. Fourth F fluid, majorly responsible for spreading disease as we share water bottles of an infected person. Fifth and the last F is fomites. It includes a material capable of carrying infection such as towels, handkerchiefs, etc. A living carrier, also known as a vector, is a disease agent that lives on the inside the body of the carrier causing disease like malaria and plague. Healthy people can also spread disease if they are carriers. These are the people who themselves may be immune to the organisms they harbor but can be a source of transmission to others as happens in the case of typhoid. Now, prevention and control of communicable disease. Next, we will learn about how to control communicable disease. The following measures helps in prevention and control the spread of communicable disease. Personal hygiene. Bathing every day and clean clothes keep our body free from harmful microbes. Cutting nails and washing hair regularly. Brushing teeth twice a day, morning and night, particularly after meals. Ensuring that your eyes are clean. Do not share articles that are of personal use, that is towels, soaps, toothbrushes, combs, razors and others. Wash hands before touching food or water and before eating or drinking. Wash hands with soap and water before touching your face, eyes and mouth and also before and after using the toilet. Food and water hygiene. Drink potable water. If does not appear clean, boil or filter and then consume it. Eat only freshly prepared food or consume it within 4 hours of preparation. Do not purchase and consume fruits and vegetables which has been cut and kept in the open for a long time. Environmental sanitation. Use sanitary latrines, avoid open air defecation. Throw waste in dustbins to avoid breeding of flies. Clean the drains regularly. Vaccines. Vaccines boost immunity and thus helps the body to fight with disease. A large number of infectious diseases can be prevented by taking vaccines at an appropriate time, such as diphtheria, pertussis, polio, tetanus, rabies, measles, chickenpox, typhoid, etc. Treatment of disease using medicines. Medicine kills microbes and or slow their growth. They are classified as antivirals, antifungals, antiprotozoals, and antibiotics. According to the group of microbes they act upon. However, these medicines should be taken in the recommended dose and duration as advised by the doctor or physician. One should avoid self-medication. Isolation of patients with communicable disease. Patients suffering from disease that are communicable should be kept in a clean environment, isolated from others. For example, in case of coronavirus, people are affected are kept in isolation ward so that the infected person may not spread disease on large scale. Education and awareness. It is important to make people aware about communicable disease, their causes and modes of spread. People should also be made aware of the responsibilities towards control of communicable diseases, ensuring use of safe water, healthy food, and proper management of garbage and waste disposal. Now we will move toward non-communicable disease. Thank you. We'll continue from non-communicable disease in the very next video. Please like, share, subscribe. And for any doubts, please mention the doubt in the comment box. We will clarify the doubts too. Thanks for watching the video.